here today and educating us all on abstract writing. I think it's such a timely presentation as we have a lot of conferences coming up, and you are the perfect person to do this. So I am going to kick it over to you. Thank you so much. And thank you everyone for joining us today.
Great, and thank you, Shelby, and welcome to all. I'm on for just a minute, but I think to make sure our internets work well, I'm going to go back off camera. What I'm going to do today is really share some important kinds of things that will help you write the best abstract. I'm going to focus on SIOP Hawaii, but this is really also about writing an abstract that's the best that it can be for any kind of organization that's calling for abstracts. I want to talk about the principles of abstract writing and then talk about the components of the abstract submission, and then give you some examples of abstract sections that can, help you organize your content and hopefully make you more aware of the evaluation process for that. But let's start with SIOP Africa. I think the biggest thing that I can say to you is follow the directions. It is very nicely laid out on the SIOP 2024 website. You want to go into where it says abstract submission and guidelines. Read the guidelines carefully so that you are doing things correctly. Each type of organization has a little bit of a different format set up. Sometimes you have to put in each piece of an abstract. Sometimes you put in an entire Word document. You need to have things ready beside you of your contributors, their email addresses, their organizations. Be very organized. But the biggest thing to say is, make sure you follow the guidelines. Don't think, well, I'll be creative and I'll do something different, because you will get points taken off. The other big thing on this page is you see the deadline. Do not think, well, I'll just submit it in a day late, because it will be closed and then you won't be able to get it in. So follow that very closely. It's under scientific information when you go into SIOP 2024. And then again, there are great details of what to do. I just sort of, cropped a little piece of this so that you read this first. And then you go to your abstract submission with a click here, and then it will tell you exactly what to do. Question that often comes up is, well, I presented locally, or in my country, we had a small gathering for a half-day workshop. Can I submit to the international conferences? And it tells you right here, if you haven't presented it at a meeting that's larger than 500, it is acceptable to submit. So you may have taken it to, conferences that are smaller. You're going to be able to submit that as well. So do know that. Do know that it can't be published already and then you're coming back to do it after it's published. It needs to be something that's fresh and new. Again, there's great things you can learn a lot by just spending a little time reading on the Congress website. It tells you the guidelines, how we select these, a declaration that you'll have to attest to, and then the limitations. So please do follow those, because that's the first principle of making the best abstract, is follow the directions. One thing we'll talk more about is the wording. You have 300 words, and most organizations and societies keep it between 300 and 500 words. For SIOP, it's 300. So you need to be organized. And we're going to talk about how you do that, and how do you make something that could have been 3 years of your work, and now you have to put it into 300 words. It's quite difficult. And so we'll talk a little bit about that. But I think the first thing to sit back that we often begin to think about, we want to go to this international congress. We're excited about it. Well, we know that our organization may only send us if something's accepted. So what do I do? And I'd like to start with you thinking about, where do good ideas come from? The important piece of that is to start to think about your practice and then think about, well, what can I say that might be unique and interesting to other individuals? And one of the things I like to say is surround yourself with your colleagues and your friends and begin to create ideas and think about, well, what did we do that was unique this year on our unit? What am I doing? Maybe if you're taking a course or you're in graduate studies, and then start to just brainstorm about that. There's a nice little YouTube uh, presentation on how to gain those best ideas and begin to put it together, because you want something interesting. And that, as reviewers, when we're reviewing 50 abstracts or so, if they're boring and they don't really focus our attention, sometimes we don't think they're as innovative as they could be. So start with thinking about what's unique and really interesting that you're doing in your own practice right now. And then you take it further of, well, it's interesting, but what kind of impact does it have on nursing? And we'll focus on nursing abstracts. What is unique about your project or about your education program that could be novel or exciting? Another thing is maybe you're doing, if it's a research study, a different methodology that has been published before, and then you would want to emphasize that. Does it have the potential to create significant impact? That's a big piece of looking at the impact of your work, that can lead to great success. And it's certainly something that's novel and interesting, and we know could have a great impact on nursing care for children with cancer, could be something that's really powerful. And many research organizations for research grant review, this is a big piece of it. I know for NIH, when I reviewed there, a big piece that we had to score was potential for impact. And so be thinking of that as you begin to put, your thoughts together. So these are the components for the SIOP abstracts, both Africa and for Hawaii. They're very similar to most other abstract submissions. Maybe instead of introduction, they might say background, but it's really title, introduction, methods, results, and conclusions. And those are the components that you will be putting your abstract material into. And don't deviate, don't be creative, use those components and stick to having things that focus in each of these, and I'll tell you more. Again, don't deviate from the instructions. So how do you begin? So you have a good idea and you think, oh, it's a great potential for impact, and you have a team that's going to be, you might be first author, but there might be 3 other individuals on there, and it's a really creative idea, or maybe it's a QI or research study. How do you begin to pull it together into 300 words is the key. And I kind of like this diagram that I found some time ago of, don't try to be just grammatically correct and perfect with your first draft. What I like to say is just start putting words down on paper, kind of like a madman. Just say, I want to talk about the purpose and this and how it changed things on my practice and what we did. And then you start to look at it and create it. Like, what's the most important thing that we want to say? What's our aim? What did we accomplish? Then the carpenter starts to tear things up and throw things away and build it into a framework that's starting to be near 300 words. And then you want to take that on to judging. And we'll talk about the appropriateness of letting other people read it and judge it and critique it. So kind of think about this, that you start off in a very disorganized way to gather your thoughts, and then you start to put it together, and then you have other people judge it. So sometimes we don't spend much time with the title, and that cannot be in your best interest, because it's really the face of your abstract. It's what catches us as reviewers to say, oh, this is interesting. Let's see what happens. Sometimes you can be too creative and your abstract title has nothing to do with the rest of your abstract, and then you won't get the points that you need to have for that abstract title critique. So keep it creative, but not too creative. Make sure your title reflects the rest of the words below in your abstract. And as you see, all of these things, it should be simple, direct, accurate, Captivating, informative. How in the world do you do that in just the title when you also have restrictions on how many words to put into that? I always say less is better. I see a lot of titles that go on and have colons and, a conceptual approach. I would say don't do that. Keep it short and simple, but informative and captivating. And the title needs some time. Our titles change in abstracts over time when I start drafting them, because you often go back and go, okay, it really doesn't reflect what we're trying to do. So pay attention to your title. And then the abstract component guidelines for your introduction. I want you to think about that the context of that introductory paragraph is really saying what this project, this research study, this education program is all about. And so the rationale is clearly stated. We don't usually recommend that you waste words, because remember you have 300 on the aim of this project, or you might say that, and you'll see an example in a moment, but you're not going to list all your hypotheses if it's a research study. You're not going to list all your objectives, because that can take up 100 words there. So you're going to have to put it concisely into a statement. But the bottom line is the introduction sets the stage for what your project, your study, your program was all about. And so I'll just give you some examples. The other thing I like to do, as you see here, is I do a word count on each section. This is 56 words. This is a clinical abstract. If you put too many words in your introduction, you don't have many left over for your other parts. So be thinking that. So this is an example. In sub-Saharan Africa, there is no standardized approach to pediatric palliative care assessment. There is a critical demand for evidence-based assessment tools that identify specialized needs of children and their families requiring palliative care in developing countries. The aim of this project was to develop a standardized approach to pediatric palliative care assessment in sub-Saharan Africa. So when you read that, there's no doubt of what we're doing in that. We're looking at, an assessment tool for palliative care in pediatric oncology patients, and the location is sub-Saharan Africa. And it's only 56 words. Now, it took us a while to get there to this, but that's why you start out and put them in, and then you begin to dissect and eliminate as you go through. Then the next part is the method session. And the method section really tells us how you did it. Think of it in that context. And if it's a research study, it'll be a little different than if it's a practice, a QI, or education project. And for our abstract reviews for SIOP nursing, we have different kinds of criteria that we're looking at based on what kind of project it is. For it's a research study, we'd like to see your design mentioned, how you sampled, what was your sample size, what were your procedures, what instruments you use, and what about data analysis. And that can be overwhelming if you have a large study that you've been doing for years, and now you have to put it together into, again, a very short paragraph. But it can be done, and you just have to think through, how can I make sure I've described the study in enough detail that that reviewer knows what I did. For practice QI, education projects, baseline standards would go into here. If you're doing a tool or a project program, you would want to make sure you describe that. What was your audience? How did you evaluate what you actually did, so that we can see an evaluation piece to that part of the method section of your abstract. And here's an example. This is a research one. 63 words were used. Symptom trajectories of 236 children with leukemia 13 to 18 years of age were explored prospectively using standardized instruments over 4 treatment periods: the initiation of post-induction, 4 and 8 months post-induction, and at the beginning of maintenance and continuation. Latent class growth analysis was used to classify patients into distinctive groups with similar symptom trajectories based on the patient's response patterns to the symptom measures over time. And so it's a lot of words, but if you begin to look at it, you understand what we did, and how we use that method section to describe the sample, give you details of who they were, how many, what we did, when we did it, and how we evaluated it, all in 63 words. So then the results, and I see so many abstracts that the methods and the results get mixed. So methods, how you did it, and results is what you found. And so you will get points taken off if you have some of the results in your methods. So really try to tie them, like separate them, and have the story be told, but have them be separated. And one of the things, and I'll talk about it again in a minute, that you can use to prevent and see some of these errors, or some of the weaknesses in your abstract, is read it aloud. When you read it aloud, all of a sudden you go, wait a minute, that's results, that's not methods. So depending on the type of study, and we've dissected this so that we're able to really look at your abstracts depending on what they are, if it's research versus QI versus education. If it's a quantitative study, we want to see that your data is presented in a clear indication. You might put confidence intervals in there. They're a little bit more powerful than p-values. That might give us an idea of what you're doing. One thing I will say, that if you have a very large study that you've been doing for years, take a piece of it. Don't try to put a whole bunch of data into one abstract, and then you, as a reviewer and as a reader, you're not sure what they're doing. And I saw that a lot in the general abstracts from young physician investigators last year. Of they had, they're proud of their large study, but they had so much detail in their abstract that you really didn't know what they did, because they were trying to present so much data. My recommendation is take one piece of it. In this study, we found, one part of it, not try to put all of the different aims and how you evaluated them. Try to stick to a focus. If it's qualitative, you have enough room there that you might at least list the themes or the categories. Were they systematically presented, and were they meaningful? Did they follow the title? Did they follow the introduction? Did the methods go along with this? And you start to see that things are synchronous throughout the abstract. If they're using a mixed methods approach, then you want to see how they one sentence possibly of how the quantitative data and complemented the qualitative data. If it's a systematic review, you really do want to see what they did and how they came with the outcomes for that. We probably don't see a lot of those. And then QI, practice education. Basically, in the results section, we want to know, how many attended your if it's an education program, how many people were involved, if it's a QI project you implemented, and then what were the results of it. There has to be some kind of outcome, whether it's a pre or post test in education, whether it's a change in practice, how you evaluated that, but you're going to have a better score in the results section, even for these QI practice and education projects, if you have something to show that made a difference with your project. Kind of keep it focused like that. And here's an education example. During the first 17 months of implementation, 598 participants from 18 countries attended an ECHO seminar with an average of 35 participants per seminar. Nurses were from Global Hope Centers of Excellence, 44%, and community hospitals or schools of nursing, 56%. Participants felt more confident in providing childhood cancer nursing care after the Project ECHO seminar, and evaluations demonstrated a case-based approach to learning was extremely successful. So it's 67 words. And even though it wasn't a fancy data analysis project like a research, it was a very basic education program, you still see that there's some metrics there that give you a feeling that people came, they liked it, and they felt a little more confident in their practice. So you can do that in very few words if you're, start with that organization of each section. And then the final thoughts of the conclusion. So often, I think, especially young abstract writers, they're so happy that they got the first sections done that they forget the conclusion and they just write, something that doesn't really match the rest of the study. And so the advice on the conclusion is go back and look at your first part, your introduction with what are the objectives of the study, with your methods, and then make sure your conclusion says something about the rest of the abstract. Because if you go off and put something that's not related to this particular piece of your study or your program, it's not going to make sense. So make sure they reflect your study, make sure the conclusion is clear, that it's supported by the results, that if you have time and there were study limitations, you might acknowledge that. I see that more often in the research, one sentence in a research study. And then also describe, if it's appropriate, what it might be for implications for practice. So don't forget the conclusion and make sure that you have those things that are, really reflect the purpose of your study or your project or your program. And here's an example. This was quality improvement, a word count of 70. The need for a culturally sensitive, and this is pediatric palliative care assessment tool, is crucial to promoting excellence in palliative care around the globe. The Delphi method was an effective tool to develop a consensus on a pediatric palliative care assessment tool to use with children and their families in sub-Saharan Africa. This standardized approach will focus on symptom assessment and improve the quality of care for children and their families at the end of life. So when you look at the rest of this abstract, it better be about a palliative care assessment tool. It better be focused on sub-Saharan Africa. And you see then that conclusion really just pulls it all together and says why it's so important. What are the implications for practice are very clearly stated there. And I like to do word counts of each section so that I'm not left with only 10 words for my conclusion. And so I often do a word count to make sure, okay, I need to take something out here so I can have a little bit more room here. And you'll be doing that numerous times for writing your abstract. But let's talk some more abstract advice. As we said, do comply to the instructions from the organization. Don't be creative with that. Be concise and clear and clean. And again, some of the ways to do that from seasoned abstract writers, and I think we have several on this call with us, that you don't write an abstract at the 11th hour. And I see that happening all the time. And you don't write an abstract once. The better the abstract, the more times it's been written and edited, passed around, read aloud. And the more you do that, even those of us that have written hundreds of abstracts, we usually start a month ahead of time just to read it, set it aside, come back, read it again. Read out loud. I even to this day read my manuscripts out loud because I catch things that you wouldn't if you're just reading it. Have others review it because that can help as well. They'll find things that you never thought of. They'll redline it and it'll make it a better abstract. And then edit. Really do keep them clean as possible. And that's how you get to that point. The don'ts, I know I've read abstracts that have a question in it and it's kind of catchy, but it takes away words and it doesn't really give much to it. So unless you have something that you just think has to have a question in it, I really probably say beware of using the question. Put that in your presentation. Be careful of jargon, because if I don't understand something, I'm already going to be marking your abstract down because I don't know what you're trying to say. Don't repeat something with 300 words. If you said it, the purpose of this, study in your introduction, don't say it again in your methods. Go right into your methods. So don't repeat sentences anywhere. Use limited abbreviations. If you saw my examples, we had PPC, pediatric palliative care, because that does take 3 words versus 1. But I might only use 1 abbreviation in an abstract. Certainly don't go more than a couple because you're going to get your reviewers confused. Remember, you're writing to 2 or 3 people that are going to score your abstract. And so you don't want them confused. You don't want them irritated. You want it to be nice and clear so they can say, wow, this is interesting. It has impact and it reads really well. And then refrain from broad statements, because what it does is just take up your words. This is the first study of its kind. To our knowledge, just stay away from those things, because your project should speak for itself. So you don't really need to have those broad statements that don't add anything and just take up the words. With 300 words, it's not a lot. And if you're started to draft already, know that. And so I think it's really important to be concise. Back to the do's there that you see on this side. And that I'm going to open, I wanted to really go through that, and then just open for questions and comments and things that we can help you now with. And then Shelby has a good announcement that will I think help some of you as you continue on that road. But I saw, where's my chat button? Just seems to have disappeared. I saw a chat. I don't know where. Is it on whiteboards? There's a lot of different buttons here that I don't usually see on my Zoom screen. But there was some comment about if we are submitting to SIOP Hawaii, can we submit to SIOP Africa? And from SIOP Africa, they said, yes, definitely you can submit ones that you're putting in April to. And now SIOP Africa's, the deadline's over. It was February 5th. So on 3 dots, okay, there's
another one too, Marilyn. If you submit and present at SIOP Asia or Africa, can you then submit to Hawaii? Oh, that's what you just
yeah.
about.
So
Yeah,
what
both
I'm told,
conferences.
and if I think Anilia's on, what I'm told that yes, you can. And I know SIOP Africa wanted those abstracts, anything that was going into big SIOP. I think that's true for SIOP Hawaii. If they submitted something to Africa or Asia, we'll accept it. And as the coordinator of abstracts, I would say yes. So I think it's a yes, and Anilia has a different thought on that, because most people that are submitting to Africa and Asia aren't going to be able to be in Hawaii. And there may be a few that would be great to be able to come and present, what they've done at other places. So the answer is yes to that, unless Anilia's going to check and see with that. I know from Africa, they want the abstracts. So some individuals are doing both, but we'll follow up and Anilia will check on that. Other questions or comments, either come on speaker or put them into chats.
Hi, Marilyn. Great presentation. I always like hearing, how can you improve writing abstract, because it is always a challenge. So what tips and strategies do you have to bring down the word count? So I'm like, sometimes get stuck and I end up with a wonderful looking abstract at 315 words. And so do you have any tips to knock out words as you are ready to submit the final?
Yeah, I'm always knocking out words. I mean, one thing I do is go section by section. Great question, Linda. And I read it aloud, and then I first look for, like, do I really need a the? Could I say that in 3 words instead of 5? And I take out the little things, and then I go to the next paragraph and do it again. Read it out loud, because if you read it out loud, you'll find them. A lot of times we won't, just, because we've read, we've edited for months. Then I go through and say, okay, I got to get rid of a sentence. I'm still at 340. And it's hard because those are precious words that you've spent months editing. And then I finally just go, oh, that sentence just has to go. It's a favorite sentence, but I'm going to delete it. And then I get there. So sometimes having others, I'm often editing and deleting words from other people's abstracts because it's easier for another person to do that than your precious work. But start with reading it aloud. Look for easy things. And then if you're still down 10 or 15, go for a sentence.
That's helpful thinking about it, because that's always a struggle for myself and
Yes.
others at the end. I think the other thing that I do, so I don't feel bad about like deleting things, I keep the original one that may be 370 words. Because
Yes.
I tell people, or I write everything I want and then I streamline it down. And if it's accepted, those are things that I may include in my presentation. So I don't throw away my original copy. It makes me feel better when I start cutting things out.
It's like that Mad Men slide where you write everything down possible. Shelby's asking, what are your thoughts on AI? I've never used that, but I think what it does is just gives you ability to put a whole bunch of ideas down just by talking. And then you can put it together and save it, because then it could be some of your PowerPoint slides, you know, some of those precious sentences you had to give up. So that's a really good point too.
I think
have-
I think Shanila wrote about the AI, and it's something I had mentioned a few weeks ago to Courtney, that I read an article about people using AI to write abstracts. And in some conferences, they actually have a disclaimer that you have to check the box if you used AI to write your abstract.
Wow,
So I think she was going to investigate for SIOP if there is anything about the use of AI, and whether there's going to end up being a disclaimer, if not this year, but down the road.
it
It was
isn't this
an
year, but
interesting topic.
yeah, we should bring it back. I mean, I'm a purist. I like to just start with my own thoughts and brainstorm, and I do throw them all over paper and all of that. But you're right. I mean, there's a lot of controversy on AI and what universities are, you know, facing with students and papers and manuscripts, etc. I would defer to I don't know, Shanelia, if you have any thoughts on that as well, and then Anelia. We'll look at that. We don't have a disclaimer for the nursing ones this year because I really didn't think about that, but maybe something in the future. Shanelia, do you have any comments on that?
Yes, basically it has been highlighted at various universities and internal conferences and through where you're writing manuscripts and submitting your thesis, that if you whether use the AI as in for the overall presentation or anything that has been abstracted from AI. And going through with the recent educational experience, that I've seen that it's becoming really common in using and getting ideas of what to write about and all those stuff. So I think that a lot of people might be able to, or might be using AI as a medium to, you know, just write down an abstract and come up with different ideas. Because when you're usually walking down your hospital lanes, and then people come up to you, say, this conference is coming up, do you have any idea what can I write about? And it's basically, you know, whatever you do is that you can write about. It's not basically what ideas can we give. So I am basically really concerned about, would there be any mechanism to differentiate about, you know, is this just an idea, or this has been actually implemented into an area, or has been researched?
Well, I know for evaluation, we don't consider that right now when we're reviewing our SIOP nursing abstracts. I would just say I've always done the old-fashioned way, got people together, brainstorm. We do that now. We decide months in advance what kind of nursing abstracts we want to submit. We brainstorm it. I kind of like the old-fashioned way. But I know AI is here and everywhere. I would just say be careful with it. And I think SIOP probably will have to maybe think about, like you say, a disclaimer in the future for that. I'm not sure though. You guys are way advanced. Any other before I turn it over to Shelby? Oh, Linda, good question. Can you address authors and how many? So most places now really don't, like, even I've seen journals through this have lifted their restrictions on you can only have 5 authors or you can only have 7 authors. To me, if the people were part of a team, say it's a QI project and they were part of your team and they were involved in every aspect of it and you're the one just chosen to be the first author, you need to put those people on it. And give them recognition. And I see sometimes abstracts with one author and I'm like, they couldn't have done this by themselves. So I know we don't restrict number. It just takes you a little more time to put 7 or 8 names in. But I do think most of our work, even research these days, is collaborative and they should be acknowledged. And maybe I'm biased on that. So if anybody disagrees with me, but if they were instrumental in your project and are a part of it, I think they should be on your abstract.
Marilyn, kind of going off of that,
Yeah.
I totally agree. I think it's so important to make sure that we recognize everyone who is part of the process and who is part of the project. I have a question about doing co-first authors on like, can you do that? Can you have 2 people like
So you can't in abstracts because it has to be one person that's going to
okay.
be and most journals also require one person who takes the responsibility. And I can't think of a journal that now allows you to have 2 first authors. I think it's just
Okay.
bottom line, it's one. But I do encourage you not to leave, especially if you're doing things across the continent. Make sure the people that are at the sites that are really often doing a lot of the work. I see that and it's pet peeve of mine. You don't even see a person that was at that site on the abstract, and yet they did most of the work. So it takes a little more time because you got to find their email. You have to have all that ready to put them in. But I would say make sure you acknowledge others because it's just a good feeling all the way around.
I totally agree in terms of inclusion and recognition.
Yes.
So the only other thing that I think maybe commenting on is at the time that you submit an abstract to a SIOP, that there needs to be, if you're interested in qualify for a scholarship, you need to do that at the same time, correct?
Yes. Yes. So any of you, if you haven't had a scholarship in the last 3 years, when you submit, if you're from a low or middle income country, click the scholarship because we base the scholarships on the abstracts. So people that come to SIOP are those that are going to be presenting. We do a few posters, but mostly it's the oral abstract submission. So do that because you're losing out on being able to be funded if you're selected. Good point, Linda. Any other questions or comments before I hand it over to Shelby? I say best of luck. We hope to see lots of abstracts this year. And I just say best of luck to all of you. And I'll turn it back over to...
Awesome. Thank you so much, Marilyn. I appreciate you. All right, so we're kind of doing this backwards today, but welcome. We are here at our February CARE working group meeting. Just some reminders of things that are coming up. So there are SIOP Nursing Network scholarships, up to €1,500 for travel and accommodations and free registration to the SIOP conference and also an annual membership for the next year. So if you are interested in that, that is on the SIOP main webpage. There is a link and you can follow that. We have SIOP Africa coming up June 4th through the 8th. The deadline for abstracts has passed for that conference. We have SIOP Asia in Yokohama, June 22nd through the 25th. And we still have a little bit more time for abstracts. They are due on February 28th. We have our conference coming up in Honolulu October 17th through the 20th, and abstracts are due April 3rd. So like Marilyn said today, months ahead of time, we should be starting this process. So if you are interested and working on a abstract for Hawaii, definitely get started if you have not started yet. And then also our care working group is starting an education task force. So we are going to try to plan and share education for all of our nursing network members. We are looking for people who want to think about the best way to not only plan the education, but to store education that we already have and training materials that we already have through SIOP. And so if you are interested in nursing education and want to become more involved in something, please reach out to Shanila or myself, and we would love to have you as a member of this task force. And then finally, we have partnered with our Nursing Network Research Task Force, Natalie and Mohammed, and they have helped us develop a list of mentors who will help review nursing abstracts. This is a huge opportunity. If you would like to be partnered and assigned a mentor who can read over your abstract, help you think of ideas, please reach out to either myself or Shanila, and we would love to connect you with someone. So this is a big opportunity if you are needing help in that area. And like Marilyn said, I think everybody needs help. Everybody needs someone to review, even if you've done it multiple times. And then coming up, our next care working group meeting, we are going to have the amazing Hazel Ozdemir. You're on the call, Hazel. Please let me know if I'm butchering your name. And she's going to talk to us about her doctoral thesis, and it is about a technology-based intervention in home-based pediatric cancer care called Home Care Family Empower. And I think it's going to be a really, really interesting topic. And so we're just really excited to hear from her on that. And I think there's some comments in the chat, so I'm going to open that up and see what we've got. And yes, Shanila shared our email addresses. Thank you for doing that. And do we have a date for the next meeting? So if we followed the third Thursday of the month, it would be March 21st, but I'm going to confirm that with Hazel that works best for her and confirm what time works best for her. And I will send it out in our WhatsApp chat as soon as possible, so you guys can save that date if that works. All right, and let me know if there's any other questions or concerns, and I appreciate everybody joining. And again, another huge thank you to Marilyn for sharing this really important presentation. Thanks, everyone.
Bye, everybody.
Bye.